Hello, my name is Emily Bullard, and this is my honors contract for biomedical ethics. And for this topic, I chose the ethics of assisted euthanasia. To start things off, I'm going to explain what assisted euthanasia exactly is. So, to put simply, it is the administering of a lethal dose of medication to a terminally ill patient. And this was first introduced by Sir Francis Bacon in the 1500s. And there are also two kinds of euthanasia. There's active euthanasia, which is the administration or addition of treatment, such as the lethal shot or anything along those lines. And there's also passive euthanasia, which is when you take away something, like if you remove a respirator or something that's keeping someone alive. Now, I know in the previous slide, I did say that Sir Francis Bacon introduced the term in the 1500s, but it does date all the way back to ancient Greece and ancient Rome, where the philosophers came up with the idea of mercy killing. However, it was not frequently used, as many opposed the idea. But there is a more modern view where the term euthanasia was used more commonly, which is in the 1800s and 1900s, and they implied it as a quote-unquote good death. However, the first attempt to legalize euthanasia occurred in Ohio in 1906, but it did not last very long, as many people questioned the ethics of it. But now, the Netherlands was one of the first countries to completely legalize it, and the Netherlands brought voluntary euthanasia to court in the 1970s. But Oregon legalized assisted euthanasia in 1994, and then was followed by Colombia, the Netherlands, Belgium, Switzerland, Spain, and New Zealand in the 2000s forward. So next up, I'm going to start talking about the pros and cons of euthanasia, and as you can see, there seem to be a lot more cons than there are pros. But anyway, the pros is that it follows the respect for autonomy, which gives people control over big life decisions such as death, and which also provides relief from constant pain and suffering, and can also prevent traumatic and unsafe suicide or self-harm attempts, and can also be seen as an act of compassion. However, there are lots of cons to euthanasia, and to sum things up, it can be really misused. For example, it could be misdiagnosed, or there could be coercion. And to fall into the coercion, certain groups of patients maybe feel pressure to choose to die. And for example, this could be the elderly or disabled or anyone who simply cannot really live on their own. And the criteria can also be expanded way too largely, which can lead to a slippery slope. It can also contradict with certain medical and ethical views, such as non-malfeasance, which says to do no harm. And also, the consent may not be genuine and can be caused by factors such as mental illnesses like depression and anxiety and PTSD, and also minimal social support and finances, which aren't mental but can also influence the consent. And also, medical practices may prefer to invest in euthanasia rather than actual treatment or management for financial reasons. And speaking on the respect for autonomy and the non-malfeasance, here's some of the philosophers' views, their opinions on euthanasia. So first we have Peter Singer, who is this nice man on the very far left, and he supports assisted euthanasia if it reduces a person's suffering. And if you can't tell, he is a utilitarian. And next up we have Leon Kass, who is the second from the left, and he is strongly opposed to euthanasia. He believes that medicine should be used to save and not to kill. Next we have Daniel Callahan, which is the second from the right, and he is opposed to euthanasia, as he believes it is immoral to turn killing into a medical procedure. And lastly, we have John Harris, who is on the far right, who supports assisted euthanasia, as he sees things as autonomy-based decisions and believes that people should have the right to choose how to end their life rather than have others choose for them. So next, I'm going to discuss some of the legal concerns and what were some cases where euthanasia was wrongfully used. So I'm going to start first with the Tyne Nyes case. Forgive me if I pronounced that wrong. She is from Belgium. And this is whenever 3 doctors were prosecuted for granting 38-year-old Tyne Nyes death. And Nyes requested this due to a failed relationship, and she also struggled with psychiatric challenges like autism and depression and all kinds of problems. And however, shortly after her death, her sisters came over and they tried to prosecute the doctors and hey, she was not mentally stable during this time, and there should have been more research done on her rather than just killing her off like that. However, the doctors considered her to be in constant and unbearable suffering, which led to their conclusion to grant her the legal injection. So next up, I'm going to talk about a very famous case about Jack Kevorkian, who is also known as Dr. Death. And this is a case seen from the physician's point of view. And Jack specialized in assisted euthanasia and administered over 130 patients the lethal injection. However, he was convicted of second-degree murder after airing him administering a lethal injection to Thomas Uke on television. And this was problematic and illegal as he performed active euthanasia rather than assisted suicide. And assisted suicide is legal in many places because the patient is the one who takes the final action, rather than active euthanasia, which is a little bit more controversial because the physician physically performs the killing rather than the patient themselves. So this last case is a little bit blurry, but it takes place in Canada, and this person's family wanted them to remain anonymous. So therefore, people just called them JMM. But JMM was granted and given medical assistance in dying, or assisted euthanasia, but last minute he decided to change his mind and he decided to go through rehabilitation instead. However, whenever he went to the clinic for a checkup, he was given the assisted euthanasia, even though he had withdrawn consent. And all of this raises the question, so if the countries that have legalized assisted euthanasia, what policies have been put in place to prevent these cases from happening? Now, this is a very large list that I condensed, but overall, physicians must have written and signed consent for the procedures, of course. And at the time of the patient's request for death, their competence must be examined, like their mental health and their just well-being. Next, physicians must report every single assisted euthanasia case. And in Belgium, they have the FCEC, which is the Federal Control and Evaluation Committee. And the Netherlands has RTE, which is the Regional Euthanasia Review Committee. In the Netherlands, the case is sent to the RTE after it is done, where it is then analyzed by medical, ethical, and legal professionals to screen for possible violations of the policies. Now, this one kind of weirds me out because I feel like they should do that before the person is killed, but to each their own. Next up, not just one physician must examine the patient, but a second, unbiased and independent physician must examine the patient. Next up, there are waiting periods that are required after the request to allow the patient to reflect and deeply consider their decision. Now, this is very similar to what actually happens before plastic surgeries, where you're kind of supposed to have that little bit of time to consider a little bit deeper before you get such a large surgery. I know plastic surgery is not death, but is a very common thing in medical areas. But this also can further confirm that the patient isn't being genuine and not just manic. And also, as mentioned in the first bullet point, a mental health evaluation must be performed, which can determine if the patient has impaired judgment caused by mental illnesses. And also, of course, only qualified physicians are legally able to administer the lethal injection. So after you've been evaluated by your physician, what makes you eligible for euthanasia and what makes you not? So if you are eligible, you must be an adult or 18 plus, be mentally there, have a serious incurable disease or unbearable suffering that has no more treatments, request the euthanasia yourself and not by anyone else, and also, of course, must be voluntary, and also must be informed of other options before confirming your choice. So if there are any other treatments, you must be aware of them before saying, yes, I want to die. But people who can't are, of course, minors, but there are special cases for that. I mean, if your child has some serious form of terminal cancer, sometimes it's okay. But there's also, if you're unstable or cannot make competent decisions, or your request is caused by pressure or coercion, you aren't genuinely in unbearable pain, you just feel like dying, or your illnesses can be treated, or lastly, a doctor refused to grant the request. You must have, again, in some countries, 2 doctors say, yes, you can get the injection. So overall, that is my presentation about assisted euthanasia. It is very controversial, and yep, these are all my sources. And I want to know what you think. I personally think that I'm for the respect for autonomy, but I mean, you might think differently, and that's okay.